Hi, this is Dr. Greg Oliver at Fat Doctor TV, and welcome back. Let's talk about your thyroid. Some people go, what's your thyroid? Well, it's a gland. It's an endocrine gland. That means it secretes a hormone. It's located right here in your neck. Now, have you ever heard of a goiter? That is your thyroid that has gotten too big, and there are lots of reasons that it can do that. We're not going to get into a lot of the diseases of the thyroid today, but let's talk more in general about the thyroid. The thyroid is responsible for our metabolism. That's why it's important we talk about the thyroid. The thyroid can become low or high. We really want the thyroid to be functioning normally. That keeps our metabolism functioning at a nice, normal rate. But in some patients, especially women, about 80% of low thyroid cases are women, about 20% are men. So in many women, they'll start to develop low thyroid at some time in their life. Part of it can be genetic. It can be caused by viruses. There's many causes. Sometimes we don't know why it happens, but the thyroid stops producing an adequate amount of thyroid hormone. When that happens, it's easy to gain weight. It's hard to lose weight. You feel like you have no energy. You get tired easily. You want to sleep a lot of the time. Your hair gets thinner. It starts to fall out. Your skin gets dry. You just feel bad all over. You can literally feel like you have lots of diseases, and you can become depressed. So if you have some of those symptoms, maybe you need to get your thyroid checked. How do you check your thyroid? Simple blood tests. However, let me tell you this. Many doctors will screen for your thyroid through a single blood test called a TSH. TSH stands for thyroid stimulating hormone. That comes from our pituitary gland. That hormone goes to our thyroid and tells the thyroid to work and how much to work. Okay? So if we have lots of thyroid hormone in our body, our brain tells the thyroid not to work as much. If we have low thyroid hormone in our body, our brain tells it to work more, so the thyroid or TSH goes up. So there's an inverse relationship with that. Now, we check for other things. We check for what's called the total T4. T4 is the thyroid that we typically produce from our gland. T4 is the thyroid that most doctors give their patients on thyroid. But that's not. That's a pro-hormone. What that means is our body converts that into the active hormone, which is T3. Again, this sounds complicated. You don't have to remember all this, but basically your body has to do some work to get you to the right hormone to keep your metabolism up. So what I recommend is when you go to and also it's not a bad idea to also get antibodies against your thyroid to see if maybe you've ever had a thyroid irritation or inflammation or infection. So there are several tests that you want to get so that the doctor can tell what's exactly going on with your thyroid. If everything's normal and the thyroid looks good, that's great. Another thing to remember is in thyroid testing, there's a high range and there's a low range. If your thyroid comes back and it's just above the low range, maybe that's not good enough for you. Maybe we need to optimize your thyroid and bump it up a little bit so it's a little higher and your metabolism is working a little better. So there's lots of questions about the thyroid. So this is an important thing to ask your doctor. If your doctor doesn't really think wait, get your thyroid checked out and let us know what you find out. This is Dr. Greg Oliver at Fat Doctor TV, and we'll see less of you next time.